My name is Tasbih Bakshi. I am a rising sophomore in Sidwell Friend School in Washington, D.C., and today I'll be presenting on an emerging global issue, diagnosing skin lesions on various ethnicities. Let's learn a little bit about me. I'm passionate about public health policy, research, advocacy, and using technology to solve healthcare issues. I've conducted, published, presented, and researched on topics of sleep disorders, skin neoplasms, and am an MIT Lemelson Award recipient. I'm a co founder of the nonprofit Billion Shines and an advocate on equality within the topics of interfaith harmony, healthcare, and environmental causes. I also compete in debate, chorus, and an editor for my high school newspaper. Outside of school, you'll find me as a figure skater on a national CTOI team, Theater on Ice team, and as an ice dancer. So let's see what I'm going to be presenting on in this video. I'll be presenting on the topic, global health impacts on my topic, the diagnosis of the problem, my solution, which includes AI, the process of the solution, and conclusions. So let's ask this question. What is skin cancer and what are skin lesions? Skin cancer is the growth of cancerous lesions or in general skin lesions. According to skincancer.org, skin lesions are the out of control growth of abnormal cells in the epidermis, the outermost skin layer caused by unrepaired DNA damage that triggers mutations. These mutations lead to the skin cells to multiply rapidly and form malignant tumors. However, early detection can save lives. The World Health Organization states that early diagnosis of cancer focuses on detecting symptomatic patients as early as possible so they have the best chance for survival and for successful treatment. But when cancer care is delayed or inaccessible, there's a lower chance of survival where greater problems associated with treatment and higher costs of care occur. In this case, many people around the world suffer from skin cancer and malignant skin lesions due to the inability to diagnose on darker skin tones and different ethnicities, and therefore a lack of global awareness, causing a delayed treatment and later on death. Did you know that skin cancer is the number one type of cancer in the US and around the world? And that too, skin cancer is the most prevalent among people of color? There were studies shown that an average 5-year melanoma survival rate in ethnic African groups was around 71% versus white ethnic groups, which was 94%. Let's look at these statistics graphically and the global implications. Here we have a picture of melanoma and its relevance in all these countries. We can see that the darkest shades of red correspond to the highest cases of melanoma, which include South Africa, West Africa, Asia, which includes Kazakhstan, Uzbekistan, Northern Europe, and the Americas, including Latin America. These effects are huge, but why is it harder to diagnose on skin lesions and skin cancer in different skin tones than others? Number one, skin cancer and skin lesions are less prevalent in non-white ethnic groups, therefore being tend to be diagnosed at a later stage, making it even more deadly. Second, lack of global awareness. Around the world, people are not sure of what skin cancer is or what skin lesions are, what they look like, what they should be on their body, how they form. They have no reason to know anything about this. Third, lack of adequate access to healthcare professionals. There are no healthcare professionals around the world that actually have the opportunity to tell people these things due to the lack of global awareness and therefore a lower index of suspicion for skin cancer patients of color. And therefore, people who are less likely to get regular full body exams are more under symptomatic symptoms of skin cancer. So, why can't we solve this right now, and what are the real life detection problems? Number one, human error. Doctors are unable to sometimes diagnose whether skin lesions are either malignant or benign, especially on darker skin tones, due to the lack of diversity in trials and studies and the shortage of people in color in the field of dermatology. Also, when they're studying in medical school, there's a lack of representation of darker skin tones in the medical textbooks, that which may mean that doctors have less knowledge on the appearance of skin cancer in people of color. If you can't see what skin cancers on darker people and on different types of ethnicities, it results in an inaccurate diagnosis of malignant or benign skin cells on different skin lesions on different skin tones. So, in my solution, I wanted to determine whether skin lesions were malignant or benign. And in this case, I had 7 different types of skin lesions that I studied, 2 of which were malignant and 5 of which were benign. The 2 that were malignant were melanoma, basal cell carcinoma, and the 5 that were benign were pigmented benign keratosis, pigmented Bowen's, nevus, dermatitis and vascular. So let's go through my process of the typical skin cancer detection, or let's walk through the components of my solution. I decide to reduce human error with technology or artificial intelligence. I trained 3 models using machine learning to detect whether skin lesions were malignant or benign. I used a wide data set, including 10,000 pictures of various skin tones, textures, and ethnicities from the HAM 10,000 dataset, stored in RGB value, and used the library Keras. Now let's go deeper into the process of my solution and training my models. Here's a little diagram of how I did so. As we can see, I first received my data, used data augmentation to perform tasks such as flipping, blurring, resizing the images, making sure it's in perfect shape. And then I split the data into training data into testing data so that I could train my 3 models, which I had, which includes the K-nearest neighbor model, which basically groups similar skin lesions into categories. And then my second one was convolutional neural networks, which is a type of deep learning um, algorithm where it has series of layers, such as the fully connected layer, the pooling layer, the fully convolutional layer. And then my transfer learning technique that I used was the output of my CNN was the input of the transfer learning model, where it grouped the similar data sets and the similar skin lesions. And then once I trained my models, I use my testing data as my input, uh, and then my output was the images classified, which was either malignant or benign. I saw that out of my 3 models, the accuracy rate of the transfer learning model was about 92%. And here is a little snippet of my code from my transfer learning model. Here are the number of epochs, which is basically a batch size. I had a size. I had about 20 epochs, which is considered the hyperparameter. And here's also a little code snippet of when I was training my model. And then here's a confusion matrix, which is like a graph, and shows like the false positives, false negatives, the true positives, true negatives, and another way to see or interpret the output of the trained model. So let's look at my accomplishments and conclusions. I was able to successfully reduce human error using technology and artificial intelligence. I trained 3 different models, and out of my 3 different models, my transfer learning technique model had the highest accuracy rate of 92% on classifying images as malignant or benign. I was able to identify whether skin lesions were malignant or benign at an early stage, therefore ensuring safety of survival. And then fourth, I was effectively able to use a large data set with diverse skin tones, variation in colors to solve the problem of not being able to diagnose on different ethnicities. So in the future, I would want to develop an app that is easily accessible regardless of location so it can be used by everybody around the world. I would also bring this AI solution and make it easily accessible to dermatologists in their office and to help many patients to reduce human error. So for my acknowledgements, I would like to thank my teachers, the resources I used, Google Colab, skincancer.org, and CBI, CDC, medical resources, and global health leaders, JHU, and their wonderful staff. Here are my resources that I used. Here's my contact and information. Thank you so much for listening to my presentation, and I hope you have a great day.